All right, welcome everyone. We are going to go ahead and get started in the interest of time as everyone continues to roll in. Welcome to our Missouri Open Door Benefit series for this month. We're going to be talking about cost-saving options for private and public healthcare. My name is Angelina Alpert, and I am a research assistant at the University of Missouri Kansas City Institute for Human Development. Our mod series for benefits is sponsored by Medicare Improvements for Patients and Providers Act, also known as MIPA, Priorities 1, 2, and 3. Missouri SHIP, the State Health Insurance Assistance Program, is Priority 1. Priority 2 is the Missouri Department of Health and Senior Services on behalf of the AAAs. And Priority 3 is UMKC IHD. So for anybody new to this session, a little bit about Missouri No Wrong Door, which this project falls under as well. It is aimed to transform the way people access services in the community. So its goal is to support individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and supports regardless of age, income, or disability. So the goal with our Missouri Open Door series is to enhance integrated supports. So if you are familiar with our integrated services star, the goal of this is to focus on all different types of services and supports, because sometimes when individuals focus on only formal eligibility specific options, it can separate them from the good life in the community and from their family that they aim to have. So with our integrated support star here, we have personal strengths and assets, relationships, eligibility specific options, which are what we cover in this benefit series. Those are going to be needs-based services, whether it's on age, income level, employment status. It's going to be things that are going to require some form of some sort of eligibility requirements. We also have community-based services and supports, which are things in the community that anybody has access to. And then we also have technology, which is going to be anything from personal everyday technology, your phone, your laptop, up to assistive or adaptive and environmental technology. And we have a Missouri Open Door series on that as well. So the benefit series is the second Wednesday of every month from 12:30 to 1:30. Next month is going to be Medicaid and Medicare preventative services and benefits. And then the technology series is the fourth Wednesday of every month from the same 12:30 to 1:30 time slot. And that is going to be later this month, May 22nd, on assistive technology for law enforcement and first responders. And I am going to pass it over to our two presenters for today.
Okay, good afternoon. My name is Gary Gummick, and as Angelina discussed, I'm with Missouri SHIP, the State Health Insurance Assistance Program. And specifically, I work with the strategic outreach team, who really our goal is to reach Missouri beneficiaries with Medicare information, with Medicare assistance, help them kind of evaluate the plans that are available to them, how they get their Medicare, just give them good, unbiased advice. And so we do that through a number of educational presentations, such as this joint presentation. So a good service for Missourians. So what are we going to discuss today? So, as I thought about this presentation, it really kind of boiled down to nobody likes to pay more for anything than they have to. And so we all like to save money. And sometimes we don't know that there are programs out there that help that. So we're going to talk a little bit about saving money through various programs, through the state and through federal. We're going to talk about a little bit more about Missouri SHIP information, just again, who we are. And then we'll go into some detail about extra help and Medicare savings. And I'm just barely going to touch on Missouri Health Net, if at all, because George is going to handle that one. So we've got that in the queue for you today. So who is Missouri SHIP? Well, again, the acronym is for Missouri State Health Insurance Assistance Program. And basically, we have counselors that go through an extensive training with the sole purpose of providing free, unbiased advocacy and education assistance to Missourians. And really, we never make choices for them. We don't recommend a certain plan or a certain provider. We just provide them with the information so they can make the informed decisions best for their health insurance needs, because everyone is an individual. They have different needs, and we just want to make sure that they know all the options available to them. So as we look at this, we're going to kind of look at, as I said before, I'm going to focus on 4 of the assistance programs, and those are Extra Help, Medicare Savings Programs, QI1, SLMB, and QMB. And so, you know, as I look at this, again, depending on where you come from, and what I mean by that is, a lot of us have had group health insurance through our employer. We're used to paying a certain amount for that coverage. Sometimes it's heavily subsidized by the employer, sometimes not, and we've got a pretty big chunk to pay. The same with marketplace insurance, the subsidies that are available, or if you're paying full rate. And so, you know, when we look at this, I know I help people that are new to Medicare, and they're just unaware of what the costs are with Medicare. So, you know, I start by explaining to them that, you know, typically Part A is free, premium free if they've paid into the system for 10 years. Part B is typically, again, and I say typically because everything's got an or else or a caveat, but you know, Part B for your doctors is usually $174.70, and so on. And so, you know, it kind of gives them an idea overall of what it is they're going to be paying. You know, the average drug plan might be around $34 a month. Deductibles with that drug plan might be up to $545 a month. So first, kind of give them the lay of the land as far as what are all the costs out there, and then what can we do to help defray some of those costs. And so that's really really what we want to do, is talk about how we defray some of those costs and what are the qualifications to do that. Okay, Sonia. So really start off with the basics. You know, are you on Medicare? So, and typically we make sure that you see the format for the Medicare card there, the red, white, and blue. And we always say, hey, you know, do you have a red, white, and blue Medicare card? Because with Medicare Advantage and some Health Net cards, there's lots of different cards out there. So we kind of want to know, hey, do you have your Medicare card? Make sure that the number isn't their Social Security number that they phased out a long time ago. Believe it or not, some people still have those and swear they never got an update. And so that's the format there on the screen that your new number would represent. Then second, once we've, you know, discovered, you know, are you on Medicare? What's your monthly income? And there are some key questions that are asked. What counts as income? And the same thing with resources. What counts as resources for you with your eligibility? So we're able to go through that with people. So we put together just really a summary chart for the assistance programs that are out there. And we're just going to kind of put this up once, knowing it's there, and we can always come back to it as we start talking about some of the individual plans. But you'll see there on the monthly income, Extra Help is the first column, and it's also called LIS, or Limited Income Subsidy. And for a single person, you could make up to $1,903 a month. So as you'll notice, if you look right, you know, going right, this is the easiest one to qualify for. So as you're looking at any of these, if you don't qualify, if you make too much money for Extra Help, then all the other ones aren't going to work either, because like I say, the Extra Help is the easiest to qualify for. So there's different costs for a single or a couple, and couples 25, 75, you see there. And then we have a resources row at the bottom. And so there's kind of this dual test when you're looking for, do I qualify or am I eligible, with both monthly income and the resources. So resources tend to be things like cash in the bank, your savings accounts, your checking accounts, investments, stocks, bonds. It doesn't typically include your house, your car, your things that aren't really very liquid, if you will. And so this kind of gives you an idea, just looking at the numbers. And again, don't expect you to memorize these or write these all down quick, because we'll have these available. But that's how we evaluate the eligibility for each of these programs, is just by the monthly income as well as the resources, and whether you're single or a married couple. Okay, Sonia. So we're going to start with Extra Help. And really, Extra Help is a federal program from Social Security. And again, we talked about it's the easiest to qualify from the standpoint of how much money you can make and income and resources that you can have. And it's a great program. It's really worth about really over $5,000, almost $6,000 actually is what the benefit is worth, is what they estimate. So it reduces your Part D premiums if you qualify. It takes care of your deductibles and copays, and eliminates some of the coverage gap based upon income and resource level. So it's a great deal. Generic drugs would run about $4.50. Brand name drugs, $11.20 with zero deductibles. So really, it's a great program. And when I talk to people about saving money on prescriptions, I also mention just things like, don't forget easy stuff like GoodRx, to be able to check the price in GoodRx as well, just to see where it comes in the price scenario. It's not exactly it isn't a federal program or anything like that, but it's also a way that people save money. So they find that sometimes if they don't qualify for Extra Help, sometimes GoodRx or a pharmaceutical foundation can help them with some of their drug costs. So to apply it, it's really pretty easy. You can apply online, and we've got a link there. That's also something that counselors at Missouri SHIP are able to help you with, is we're able to help you apply for Extra Help. And so you can call that number 1-800-390-3330, and a counselor will call you back, and we can walk you through and help you sign up for this, kind of walk you through that. There's other ways too. You can call Social Security at their 1-800 number, and you can apply via the phone. You can also apply in person at the Social Security office. And I hear varying stories about how quickly you're taken care of if you apply either on the phone or in person. But some people have told me they walked into the office and got right in, which I was very surprised. Other people said when they tried to make an appointment, it was, 2 months out. So online is going to be the quickest way if you've got access to a computer or have someone with access to a computer. Okay, let's switch to Medicare savings programs. Now, the Medicare savings programs are really administered by the state of Missouri, and they help you pay your Medicare cost if you have limited income and resources. And that goes back to our chart a few slides back that talk about that. You have, or you're eligible for Part A. And really, we're going to talk about three main programs, and each kind of have a different benefit. But QI1, or qualifying individual, SLMB, or specified low-income Medicare beneficiary, or QMB, qualified Medicare beneficiary. And with these programs, they're all geared towards helping you pay your Part B premium of that $174.70. So the state, if you qualify for these, pays for your Part B premium. It also automatically enrolls you in extra help, so you don't have another hoop to jump through, so to speak. If you qualify for one of these programs, they'll automatically coordinate with Social Security and get you on extra help as well. So it's kind of a 2-for-1 if you're on a Medicare savings program that happens for you. So that's a great thing. And with these Medicare savings programs, if you're on that, it does allow you more flexibility to change your Part D plan at least once a quarter. Gets rid of some of if you have a late enrollment penalty, say you postponed getting on Medicare and there's a late enrollment penalty, that does away with that as well. So that's a good thing. So the state has a nice online system to apply for the Medicare savings programs. It's listed down there. And again, we've got the Missouri SHIP number that's available to help you with that. We can help you apply for that as well. And so those programs are out there. But again, I would say, we're going to talk a little bit here. Georgia is about Missouri Health Net or Missouri Medicaid. Important information there, again, that can benefit you with some cost savings as well. So lots of ways out there. I think the big thing is, when in doubt, call Missouri SHIP and we'll walk you through whatever questions you have. And with that, I'll turn it over to Georgia unless there's questions, or we can do questions at the end, however you want to deal with it.
Sure. Well, there is one question in the bucket, and I may partially answer this question. So but I'll tell you all what the question is right now so you can noodle on it for a second. The question's from Kelly, and she asks, if an adult with an IDD, intellectual developmental disability, has Medicaid, should they also apply for Medicare, and pros and cons in doing so? If you feel like answering that now, you're welcome to. If not, we can wait.
Yeah, my answer typically on that, whether someone should apply for Medicare, part of it boils down to cost. If they've got their quarters in for Part A, no downside for that because there's no premium attached to it. If they can qualify to get their Part B paid for, again, that eliminates that financial hurdle for some of them that's too difficult to get over, and that's why they aren't on Medicare. But being on Medicare gives you more choices for providers, and that's kind of the big plus. If you can afford it, I would say yes, that's a good deal to be on Medicare. It gives you more choices, and the programs we just discussed can help pay for your premium. So it's a win-win.
Okay, thank you. And I will actually touch on that a little bit more in my presentation as well. So, 1 second, I'm going to switch screens. Get back to where we left off. So my name is Georgia Mueller, and I am a coach on disability service navigation. I coach families directly, and I also do private consulting with individual businesses on some of these things so that they can help their clients do a better job as well. Yes.
Georgia, I'm sorry, you're not sharing your screen.
Oh no, I thought I was. Hang on a second here. Sorry, guys. So it's really important that families understand their private insurance as well. And I know we're primarily talking about Medicare and Medicaid today, but so often people leave the opportunity for private insurance on the table. And I really want to make sure families don't do that. I should remind you too, my audience is all ages. So I'm talking to families of children as well as families of adults. Get a lot of conversations with families whose kids are of that transition age where they're starting to get into the adult services too, and it gets really confusing. So, but know that I'm talking to all ages, and depending on circumstances, there are quite a few of our adults who can still definitely take advantage of private insurance on top of being eligible for Medicaid. So that's part of why I talk about private insurance so much. So it's really important, obviously, read your policy. I know that sounds so stupid, but most people really don't read their policies. Most people don't have an excuse to dig in and read their policies. So what I would urge is next time you have a problem that you need to solve, dig into your actual policies, all of them, and study that problem from all the different policy angles, whether you're dealing with Medicare, Medicaid, private, etc. Add them all together and read all of them. There are times when you can seek a case manager through a private insurance policy or through managed care. And if that's available to you, I strongly recommend it. These are very seasoned people that have generally spent quite some time on the front lines. And a lot of times they have some great tips for you as to how to get your problems solved and access different service providers much more quickly than you could just on your own trying to figure it out. So please take advantage of potential case managers every step of the way. Make sure that you understand the format of your insurance. There is such an enormous difference between the different types of even private insurance. So you've got private insurance that's straight up regular from your office work. You may have an employer who is very large and uses what's called an ERISA program, and that is going to allow them to circumvent some of the state requirements. And so I think it's super important to know, are you working, which type of policy are you working with? There's a huge variety. And then employment-based pre-tax options are crucial. Please, please, please understand all your opportunities there. A lot of times people will tell me they can't get something paid for, they can't get anything paid for, and they haven't exhausted those options. So they've not really maxed out their child care credits. They have not maxed out their health savings accounts. All those types of different accounts will add money to your bottom line when it comes down to it. So please don't forget to do that. And I've got an inaccurate percentage on that tax obligation question there. So until you hit 7.5% of your adjusted gross income, there's not anything that you can write off from your medical expenses. So keep track of what you really do spend out of pocket. And if you've got a kiddo with high medical needs, there's a good chance you're going to hit that 7.5% and be able to deduct a portion of the rest of that from your taxes. Of course, talk to your tax people, but I like to play with TurboTax and learn from myself too. So do whatever you're comfortable with. It's very important that your private policies hit all of the 10 essential health benefits. And this is what was required when they passed the legislation that established the ACA insurance and all that. So it's very important that we hit the 10 essentials. If you're having problems and things don't make sense with your policy and you're like, don't think that they're fulfilling their requirements, you most definitely can give the Missouri State Insurance Commissioner's office a call and learn more about what they're supposed to be doing so you can find out whether or not your policy is in line. And that can give you some leverage in bargaining for different supports and services that might have been declined before. For example, some that come up frequently are those involving the speech parity law and the mental health parity law. So a parity law essentially is saying that if you were to provide this service for one category of people, you can't suddenly not provide it for another category of people. And specifically, we see this a lot with speech and mental health for children who have developmental delays, because the old criteria was that it would be rehabilitative only. And now we know it's actually not accurate. It's supposed to be habilitative. So even if they've never had speech, and then they can still have speech therapy as a person with a developmental delay. You're not just regaining speech, you are gaining it to begin with. And your child cannot be declined from that service. So next slide, please. Yep. So here are the 10 essential health benefits for the Affordable Care Act, and you can read through all those. Essentially, I just kind of ran through a lot of them, but your basic health care, some preventative for sure, hospitalization, mental health is in there. The important ones that I want to make sure families know that they should be emphasizing when they need is that access to mental health, behavioral health treatment, counseling, psychological therapy, habilitative services and devices. So augmentative communication devices, for example, medical equipment that your child might need if they use a trach or something like that, or a hospital bed. And of course, the therapy that goes with it. So next slide, please. So the other thing that is very important is we've got a much stronger emphasis now on the ability to use marketplace and adult expansion Medicaid services. Well, marketplace isn't really Medicaid per se, it's ACA. But some tips on using that, and I'm sure my predecessors on this talk would have great tips on using this too. These are the tips I share with my families that I support. First of all, I really want you, if you're going to use marketplace insurance, please go get an agent or a broker, because their information is priceless. They do such an amazing job of making sure you find the right policy and get you appropriately signed up for. I avoided several pitfalls when I decided to become self-employed. My husband and I needed to tap into this insurance. I'm really glad I didn't do it by myself. I tried to do it by myself the first time. It was not good. Get help. Don't feel bad. You need help. It's all good. There is a premium calculator, so you can get an idea based on your income and things like that as to what your premiums are likely to be. And you need to earn at least over 139% of the federal poverty level in order to have enough cash flow to be eligible to purchase a marketplace policy. However, if that's not your situation and you're earning at less than 138% of federal poverty level, then that's going to push you into the adult expansion Medicaid category, which is fine too. They've got a lot of great policies in both. And again, you can still get help navigating that system, likely from the same broker, but if not, they'll know who to send you to, and it may be shipped, which is great. That's fine too. So you definitely want to get more information about each state's requirements for information on marketplace and adult expansion policies. And adult expansion policies are state by state. So be absolutely sure that you're really talking to somebody about your own state on that policy, because it's very specific state by state. And the next slide. So knowing Medicaid in Missouri, whoo, this is so much fun. For our families who have kids with developmental disabilities, the gold standard for that is really considered to be MoHealthNet. And I say MoHealthNet for people with disabilities so that my families and clients understand that I'm talking about a very specific policy. I'm not just generally talking about MoHealthNet, the umbrella. I'm talking about for disabilities specifically, which also could be for aging, of course. But so this is available it's available for all ages. There are income ceilings, of course, and these do provide access. This version does provide access to Medicaid waivers, which again is really crucial for those folks with developmental disabilities, whether they're a child or an adult, either one. And we used to also call this old school, we would call it fee for service or straight Medicaid. So if those terminologies make more sense to you, that's where that came from. Ticket to Work Health Assurance is another version of that same policy. The difference is that you can have more cash flow because you are entering this program as a disabled worker. And so they have made quite a few really nice work incentive benefits in there that give you that leeway to earn at a much greater rate than you would be otherwise. It doesn't penalize you. In fact, it incentivizes you to work while you are still accessing Medicaid. So, and you may even not even continue to have Social Security payments, but you still need that Medicaid possibly if you drive a wheelchair that costs $15,000, for example. These are very expensive pieces of equipment that people typically cannot maintain out of pocket, and someone might actually quit their job so they could get back on Medicaid to get their wheelchair fixed. And we really don't want that to happen. We want you to keep working if at all possible. And that is tied in with Social Security and eligibility for that. S-CHIP, we went a little bit into some state plans, but S-CHIP, or we just call it CHIP sometimes too, is that children's Medicaid program that's available up to the age of 22. It may or may not have a premium attached to it. So depending on where your income lies within that 0% of federal poverty level up to 300% of federal poverty level, you could actually end up with a premium. It's never going to be that large, and it's completely worth it. You can actually access a Medicaid waiver on those programs as well. And this has been such a lifesaver for so many of my families. So if you think that you're losing Medicaid because of your income, please check again. Check the S-CHIP program and just verify that you don't qualify for it. Managed care Medicaid is the one that's available to most of our families who have children under the age of 22, or at least they start under the age of 18. And that income can go up to 148% of federal poverty level. And S-CHIP and managed care Medicaid, both, neither one of them actually have anything to do with having a disability, but because they have those 10 essential requirements, they're still going to have to cover all of those needs anyhow, one way or the other, whether a disability has already been determined or declared or not. And then the last, of course, is the Missouri Adult Expansion Medicaid, which I already mentioned. And the next one, please, slide 25. So how do you dig in and understand all this so you can actually do something with this information? First of all, I really urge families, go find out what version of Medicaid you have if your child has Medicaid. You can do that in a couple different ways. You can go online to a website that's part of Medicaid that says check your status, and it will tell you, it will give you an abbreviation for the version of Medicaid you have, which is a very good start. But it still might not fully answer the question. It may not answer for you, why are they on this version of Medicaid versus another one? And that's the question I want to know the answer to as your benefits specialist. I want to really dig in if needed and find that. And so what I may ask you to do is to go to one of your trusted healthcare professionals or somebody you work with in case management and ask them to look up what's called the medical eligibility code. And that will tell me exactly why you are eligible for that version of Medicaid. And it can help to unravel some problems sometimes. So what is MoHealthNet for people with disabilities? It is exactly a full coverage program, just like anything else. It has all of the medical, but it also has a very high emphasis on your peripheral services like counseling, therapies of all kinds. It has the biggest pool of providers in the entire state. So I really encourage people, go ahead and make that jump if you can. If your providers that you need are willing to take MoHealthNet for people with disabilities, why wait? You know, it's got a plethora of great resources in it that are very easy to use. In fact, you can even go online and I Google find MoHealthNet providers, and I land straight on the exact link I need every single time. I can go in there and put the specific criteria as far as what county and what specialization does that person need to have in order to fulfill my needs. And then I search by a couple other counties too, because it does narrow it down to the county that you're looking at. But if I can expand it, then I might be willing to drive one county further for that service, and that's okay. And managed care, by definition, is a little different. It is managed by one of the 4 companies you see listed across the bottom of that slide. And their job is, you know, in large part to keep a lot of those excess costs down, to streamline the process. And that is what they do. And managed care looks different in every single state. And each of these managed care programs has their own different emphasis, their own different pools of providers. So if you're going to switch from one to another, I really recommend doing your homework. You know, you can get online for all these different providers as well as MoHealthNet and find out who all is there that you would want to work with, who are the people you want to hire as your therapists, doctors, etc. And you can find that information before making that decision. You can also ask other families whose kids have similar needs to yours, which ones they use and what did they think of that. Never hurts to ask another parent what they thought, right? Okay, next slide, please. HIP, Health Insurance Premium Payment Program, is one of my favorite tools ever. It is not known, which is crazy because it's advertised all over the place, but essentially the HIP program is a health insurance reimbursement program. They're paying back for your premiums, your private premium policy. What they are looking at is if your private policy combined with Medicaid is going to save the state a considerable amount of money, then they're going to prioritize that. It's a matter of saving state taxpayer dollars. It just so happens you will significantly benefit if you qualify. We did use this program for quite some time with my son when he was on private insurance with his Medicaid, and it reimbursed our private premiums for the entire family. Pretty big deal if you are down in that category, the financial category of qualifying for Medicaid. This could change your life, no doubt, absolutely. And these are the criteria. There's a few criteria. Essentially, somebody with Medicaid needs to live in your house and be on both policies in order for you to be eligible to apply to the process. They also will give you an answer about whether or not your policy that you're asking to get covered is going to be covered before you fork out the money and before you sign your person up. So you don't have to be out those premiums before you make this decision. You'll have enough information in advance notice. Let's see here. I'm going to go to the next slide if you would. So what is great is they have a landing page. So I literally just Googled Missouri Medicaid HIPP. And again, the first place I get, it's right there. What's great, I can go watch a video about it. I can read a bit more about it. There's phone number. You can actually call and talk to a human being. This is one of the nicest government offices I've ever called. These people are so nice and helpful. You can call, you can ask about your application. You can make sure that you understand what you're doing before you make this decision. And they're incredibly gracious about sharing that information with you. Excellent customer service. I'm super impressed with them. You can mail your information in, you can email it in, whichever you feel more comfortable with. Okay, and the next slide, please. Again, I'm a coach. I navigate disability service systems with families, and my company is called Visioneers DD Navigation. And so people just hire me individually to do this. And then when a person becomes eligible for a Medicaid waiver through Department of Developmental Disabilities, I can oftentimes work as what's called a community specialist under your Medicaid waiver, and that's part of the self-directed support system there. Let's see, what else? So I counsel people on benefits. I also help you with the application and the utilization of those programs once you apply for them. I work with people of all ages, it does not matter, and all abilities and disabilities. So even though I'm primarily well-versed in developmental disabilities, I definitely have worked with people with psychiatric needs as well as physical needs and just aging in general. So any of that gamut is fine with me. I'm happy to help you figure that out. Also family entrepreneurship. Obviously, I own my own business, so I believe that families can choose this option if that's what's best for them. And I can do this information with y'all in one-on-one sessions, or I can do group. And then most of my work's by Zoom, phone, in person, etc. And then my contact information is that very last slide. Thank you. I think, I'm not sure we finished answering that last question. Let me look at that one more time, because this is kind of the DD. So the first question we have from Kelly, again, I'll read it again. If an adult with IDD has Medicaid, should they also apply for Medicare? Pros and cons. Okay, this is important. If you don't apply for Medicare at the time, in the time frame that is set forth as to why you're receiving access to the Medicare, it can increase your premiums permanently for life. So it is very important to know exactly where do you stand in regards to your opportunity to accept or decline enrolling in Medicare at that juncture. And that is going to be different for everybody's circumstances, but a lot of the families I support, they have families, parents who are retiring soon, for example, is going to be one of the main reasons they're getting that offer. Or they've worked for a while and now they can't, for example. So my answer on that again is going to be find out exactly why you're being offered Medicare right this minute, and what does that mean for you if you choose to wait, because it can exponentially increase your expenses over the years. Thank you.
Yeah, it looks like Diana has a question for us too on, can a person on SSDI Medicare do the savings program at age 65 or at 65 years of age? And once you hit 65, you age into Medicare. So in essence, you lose the entitlement based on your disability, and you age into Medicare. So at that point, you kind of get almost like a do-over. You get the opportunity to enroll in Part B, enroll in a Medigap, or you could enroll in a savings program as well. So that's kind of your second shot at enrolling in Medicare. So again, you can choose your Medicare Advantage, your original. You've got options at that point, just like it was kind of like your first time. So hopefully that answers your question.
And Patty had asked earlier, what does DD stand for? Sorry about that. Too many acronyms. It's occupational hazard, developmental disabilities. And that's how I know Institute for Human Development, which is why I'm sitting here today, but that may not necessarily be fully comprehensive of the Open Door program. So sorry about that. I should have remembered that.
Okay, if anybody else has any questions, feel free to put them in the Q&A. We will stick on here for just a second. But if not, thank you to both of our presenters today. We appreciate you, and we appreciate everyone who joined us today. Thank you so much, and we hope to see you next time.
Thanks.
Bye.